Source is a podcast made by women for women. We talk with a wide variety of experts, from a sex therapist to the CDC, to bring you the stories that you're only going to hear here. Our goal is to entertain and educate because it's more clear now than ever before that we as women are doing so much more as parents, as spouses, as employees, just as everything. Don't miss out on being in the know. Subscribe to Soul Source wherever you listen to podcasts today and leave us a review. This part is really important because that's how we can continue to bring you the content you love each and every day. So buckle up, Soul Source Society, because we're about to get started.
What we want individuals to understand is that this can happen to anyone, and that it really is a disorder. It's a health issue, just like high blood pressure is a health issue.
Hello, everyone. I am your host, Raquel Lamel, and today we're talking about a topic that dominated the news before COVID took over our lives. And just because it's faded from the airwaves, it does not mean that it's stopped being a threat to our country. In fact, it's now more dangerous than ever before. I'm talking about the opioid crisis. According to Harvard T.H. Chan School of Public Health Assistant Professor Michael Barnett, 2020 was poised to be the worst year on record for the opioid crisis in the United States. Now that's because people struggling with substance abuse issues were thrown into the perfect storm, so to speak, when COVID hit. In many ways, the stresses of the pandemic pushed people who may have been making progress with their opioid addiction back towards substance abuse to cope with what was happening. In other cases, the pandemic could have been the trigger to make someone consider using drugs. The big question now is, how can we help those struggling with opioid addiction try to prevent deaths and usage from rising? Dr. Halena Gazelka is an anesthesiologist and serves on the Opioid Stewardship Program Subcommittee at the Mayo Clinic. She's also the host of the Mayo Clinic's Q&A podcast. She's here today to talk with me about why people get addicted to opiates and how we can try to stop this crisis from getting out of hand. So Dr. Gazelka, welcome to Soul Source.
Thank you, Raquel, for having me this morning. I'm happy to be here. That was a lovely summary.
Oh, well, we try to sum it up real nice and sweet for people so that we can get into it a little deeper. So first off, I want to ask you, where do things stand right now with this opioid crisis in the U.S. from your perspective?
Well, I have to say, Raquel, that it's a little discouraging right now. I have been chairing Mayo Clinic's opioid work for 5 years, since 2016, when we decided we needed to do something at Mayo Clinic, and that's for our enterprise. So I'm in Rochester, Minnesota, but we have hospitals in Florida and Arizona and Wisconsin. And we had made some really good progress amongst our providers and our education and our patients. COVID came along and kind of shut down our work as it interrupted so many things. And that's just a small microcosm of what's been going on in the country as far as overdose and overdose deaths. It's been spiraled out of control, as you stated earlier.
It's got to be hard to see as a doctor, seeing it basically go backwards when we were making so much progress.
It is really hard to see, because when you see one patient who struggles, and you know the amount of work and investment that it takes, both to prevent that for patients and then to help patients once it occurs, it really is discouraging when you see things slide the other way.
So how have the numbers of overdoses and addictions increased since the pandemic started? Do you have any numbers to show like how much it's gone up?
Sure. The last number that I've seen from the CDC was collected in June of 2020, and that was the year prior to that. So about May of 2019 to the end of May in 2020, and 81,000 individuals died of overdose. And this is the most of any year in history.
Wow. That is a lot. Why is this happening? Why are the numbers so astronomical?
Well, I think even separate from COVID, there's a problem with fentanyl in the drug supply. So, everyone is familiar pretty much with heroin. Heroin is an opioid that is produced from poppy flowers, from morphine. It's a derivative of morphine. It's cheap. It is grown wildly in Mexico and some areas in the Middle East, and brought into the country. Fentanyl is far more potent. Heroin we think of as being about 2 to 5 times as potent or as strong as morphine. Fentanyl is 100 times as potent as morphine, and it is very easy to bring into the United States. Much of it comes from China and the US mail system, courier systems, or via Mexico, but it requires such small space for such a potent drug. And then it gets mixed into the drug supply. People don't know they're taking fentanyl, of course, and it gets mixed into the drug supply. And because it is so potent, it is easier to overdose on.
So it's getting mixed in. So people don't even realize that that's what they're buying or they're purchasing is fentanyl. They think they're purchasing, say, heroin, and it's heroin laced with fentanyl.
That's correct. I can tell you a story from Minnesota. Just recently, there were thousands, tens of thousands of oxycodone pills recovered, and they were fake oxycodone pills. They looked like oxycodone that would have been produced legitimately and legally, but it was a pill press that was used illegally. But there's fentanyl in those oxycodone pills, and people thinking that they were taking oxycodone and understood how much oxycodone they could take overdosed because they didn't know they were also getting fentanyl.
I mean, that poses the question of why. Like, why are people doing that?
Well, I mean, if you think about it from a business perspective, I hate to say that, but if your drug is potent, not everyone dies. And if your drug is potent, people want that drug. It gets a good reputation on the street. So one of the reasons is that it increases the potency and the high. Fentanyl is an incredibly addictive substance, and it improves the high that people get from taking these other drugs. And so they like that to an extent. I think one of the things that I neglected to mention is that sometimes people do know if they're getting fentanyl. There are some programs in communities to pass out fentanyl test strips to people who are using street drugs, and they test the drugs to be sure there's not fentanyl before they use them.
Oh my gosh, it just breaks my heart hearing about this. Now you compact that, so somebody who's already got an addiction is buying a drug they don't realize is even more highly addictive than the drug that they think that they're getting. And now you've got a pandemic on top of it all. So how is COVID making this problem worse?
Oh boy, COVID has made so many things worse, hasn't it? I think only
everything.
One of the good things to come out of COVID is Zoom. I kind of enjoy Zoom, but yeah, it's been really disastrous for people with mental health disorders and with substance use disorders or opioid use disorder. There are a number of reasons for that. I think at baseline, anytime that the economy is bad, that there are stressors in life. So socioeconomic stressors, psychological stressors, personal stress that people are under, loneliness and isolation, that increases the urge to use substances if people are susceptible to that. And then you add to the fact that COVID took over all of our healthcare. Everything was dominated by needing to put resources into COVID. And so a lot of treatment programs for individuals with addiction were not financed, were not renewed, were not funded. And so access was limited. Further, if you had inpatient programs, for instance, and you had rooms that people shared, you couldn't necessarily have them share rooms during COVID. And so access was significantly decreased.
Oh my gosh. So, and then you take that access, degraded, and you also have social distancing, right? And that's still going on. We're still being told isolate and stay away from people. So that can only make an addiction worse, I would assume.
Yes. Yeah. I mean, think about it. Haven't we all had a little bit of time of depression, discouragement, or anxiety during COVID, wondering, my goodness, are we stuck like this forever? Is this what life has been reduced to? Imagine compounding that with a substance use disorder, opioid use disorder, or a severe mental illness. And it is really difficult for individuals.
So if someone is struggling with an addiction to opiates and they turn to them for relief right now, and things aren't changing, and we're in this COVID world, I mean, how can they try to help themselves? What can they do? And is that possible? Or does someone need to reach in and help them?
Well, I think either. But I truly think that if an individual has a substance use disorder, until they can identify it and want to seek help for themselves, it's unlikely to be successful. I think that starting with a primary care provider, if individuals have a primary care provider in their, a family practice doctor, an internist, someone that they have relied on for medical care and feel safe talking to, that can be helpful. There are emergency departments that when people present intoxicated or at risk, that will help people find resources. The SAMHSA administration through the federal government, which is the Substance Abuse and Mental Health Services Administration, has an 800 number for people who either have mental illnesses or difficulties with substance use disorder, and they will help people find help wherever they are in the United States.
Okay. Now, the other question is, if you are addicted to drugs, do you realize it? Like, do you know that you have this addiction, or are you in denial?
That's a really interesting question.
Yeah.
There's a distinction I'd like to make. There are two issues that can occur, multiple side effects and things that can happen from opioids, but there's an issue of dependence, and then there is addiction. So
Okay.
dependence happens to everyone who takes opioids for a period of time, psychologically, physically. It is a physiologic response of our bodies that have seen that drug for a period of time. So what happens is you take oxycodone, you swallow it, it's digested, it makes its way into your central nervous system, to your spinal cord and brain, where there are little receptors that medication sits on and activates those receptors to help with pain, to increase dopamine levels. And once your body has seen those medications for a period of time, it likes it. And if you remove them, people feel the effects of that and go through withdrawal. That's dependence. It can be psychological, but it also is physical. In other words, people can feel depressed if their opioids are taken away suddenly. That's psychological, but it's also physical. They get this feeling of bugs crawling and sweating and palpitations and nausea that's awful. Addiction is a pattern of behavior. So addiction means that someone who is dependent on a substance engages in behaviors that put at risk their entire life. In other words, they will risk their relationships, their job, their financial situation. There are legal ramifications, obviously, that people will engage in illicit activity in order to obtain the drug that drives them and that they are addicted to. So while dependence is physiologic, addiction is a series of behaviors that can be developed.
So addiction, I guess, is this fair to say addiction is a result of dependency?
Yes, I think that's a fair way to put it. The terms we prefer to use now are things like substance use disorder or opioid use disorder. Addiction has very negative, I guess, connotations to it. And what we want individuals to understand is that this can happen to anyone, and that it really is a disorder. It's a health issue, just like high blood pressure is a health issue.
So if someone is on the outside and they're supporting someone, they know someone who is maybe addicted, and they that's hard to watch, right? A family member, a friend, you love that person. So what advice do you have for them, especially right now?
Well, I think that your love and support are important, even if that individual won't tell you that right now or is unable to express that right now. So keeping an eye on them, being supportive to them. Mental health disorders and substance use disorders are worsened through loneliness, not having emotional contact with others. So that's very important. Number two, get some Narcan. Narcan is a brand name for a drug called naloxone, which is the drug that reverses opioids, essentially. So when people die because they overdose on opioids like fentanyl, oxycodone, heroin, they die because those drugs act in the central nervous system, in the brain stem, to stop us from breathing. They slow breathing until they stop it. People die because they don't breathe. And so what naloxone does, you squirt it up someone's nose. It can be administered in other ways as well, but the most way because it's so simple and anyone can do it, is to squirt it up the nose. And then it reverses or causes for that medication to come off those receptors and be replaced by this drug naloxone. And it reverses the effects of overdose. And sometimes people have to have multiple doses of it, but anyone who loves an addict should have that available. I don't have any personal colleagues, friends who have opioid use disorder that I'm aware of, but I carry Narcan because just like we put defibrillators, for instance, for people who have heart attacks in public spaces. People die of opioid use disorder or of overdose in public spaces. And I would want to be ready for that eventuality. But that's one thing. The other thing is to find sources for help, like we mentioned earlier, and to offer to help that person and to help them to find resources. And like I said, until someone is ready to face the music and to get honest and to want treatment, is very hard. It's very hard to step away from addiction because they'll end up going back and back and back until there's real commitment and treatment.
The idea of having to have Narcan on hand, I mean, just hearing you say that, it's like, it's scary. It's scary to have a drug to bring somebody back to life.
It's crazy, isn't it?
Yeah.
Just last week or the week before, I read how COVID has decreased life expectancy in the United States by about a year because so many people have died of COVID. However, 2 years before that, an article was published in the Journal of the American Medical Association stating that opioids, for the first time in history, our life expectancy is decreasing because so many people are overdosing on opioids. It's more common to die of opioid overdose than it is to die in a car accident now, believe it or not.
Wow. So you talked about getting Narcan. I want to, just for people out there, like, how do you get it? Because a lot of things you need a prescription for. Is this the same sort of thing? How do you get it to have it on hand?
That's right. Most states have passed laws that Narcan be available in pharmacies so that you can go in and purchase it. So, and it depends on the pharmacy, whether they carry it or not, but there are a number of the big box, big brand pharmacies that do carry naloxone, either the generic, which is less expensive than the brand name Narcan, that you can go in and purchase. The other way to do it is to ask your physician for a prescription. So we had a new insurer for our medications last year, and I worked with them through our Opioid Stewardship Program to have them make naloxone available to every Mayo Clinic employee. Everyone can buy once a month 2 naloxone doses for $10. That's the copay on it. And so you don't have to be on opioids yourself or abuse opioids. You can get it to carry for someone else. And so there is access to it. You just have to ask.
Okay. Awesome. So, I mean, we're talking about this, right? We're trying to raise the red flag right now because this is becoming a major problem as a result of COVID. So you're looking out at the horizon. When COVID is over, what is your prediction for what things look like here with the opioid crisis?
Boy, it makes me sad, quite honestly. I really, a few years ago, I testified before the Senate Help Committee several years ago, and someone had asked me, what do you think? Is there hope for this? And I do think there is. It's such a multifaceted problem. It started with people like me overprescribing and giving people too many opioids, which reached the rest of the community, which led for a hunger for opioids and a demand for them that was then filled illegally. And so now many people are receiving them illegally. So they're coming into the country from other places. Some of it is still prescribing by our providers, but there's just, I think COVID has accelerated that again, because think about it. If I couldn't see my pain patients. I practice pain medicine at Mayo Clinic, and that includes me helping people with all facets of their pain journey, which can be medications at times. It can be opioids at times. It can be interventional procedures that I do. We stopped doing interventional procedures and doing surgeries for months at the beginning of COVID. So what do you do to help somebody through a time like that? You write them a prescription sometimes. And so I fear that even the gains that we had made with providers who can prescribe opioids may be reversed after COVID, and that there's going to be a lot of work to kind of rein that in again, and to, obviously work like the DEA to get control of the substances coming into the country, important, and therapy for patients. I think one of the things that we haven't talked about yet is medically assisted therapy for individuals who have opioid use disorder. We used to say, you just got to stop it. Like alcoholics, for instance, you got to stop drinking and you should never drink again. All of us know someone who has struggled with alcoholism, and they have committed to not drink again in their lifetime. Opioid use disorder is different. It has a different drive to it for individuals. And we know that they can be more successful if they are treated with a medication, which is often an opioid itself, interestingly, to help them defer from using illicit opioids. And so I think access to those programs is going to be very important for that. And that has increased during COVID. We are trying to get more providers to prescribe Suboxone or buprenorphine. Some of the methadone rules have been relaxed. Methadone is also used for medically assisted therapy. And so I think there's going to be a lot of work to be done after COVID.
Oh my gosh. So another question that I have for you is, we talked about the isolation piece and how that can get somebody to turn to opioids, but is another piece to this mental health. We hear a lot about mental health right now with COVID. Is that another piece? Are a lot of people who are addicted to opioids, do they have a mental health condition prior to that addiction or not?
Yeah, it's kind of that which came first, the chicken or the egg. But
Yeah.
Yes, mental health disorders definitely go hand in hand with substance use disorders, be that use of tobacco, use of alcohol, use of opioids or other controlled substances. So yes, they do go hand in hand, and they chase each other. They make each other worse. And so it's really a cyclic situation where the individual needs to have help for both of those issues before they're going to be successful in treating either one of them.
It's this world that we're living in. It's like, it's just compounding all of these problems. Oh my goodness. So what do you think is the biggest misconception that people have right now in regards to people who have an addiction like this?
I think there are so many of them. I think the biggest one is probably that addicts are out there having fun, that people are using these substances because somehow they're getting away with something that you and I aren't getting away with. They're getting oxycodone from someone. They're high all the time and enjoying themselves. They aren't. Addiction is painful. It's horrible. When you first start using a substance, it feels great. Dopamine is released in the brain. That's that happy drug that makes us all feel great and like we could conquer the world. But eventually it takes more and more of the same substance to release the dopamine. And the dopamine levels eventually never get as high as they first did. And so eventually people are seeking and scrounging and trying to get these substances illegally just to get themselves up to where they could function for the day. Not like to the level that you and I are, where we hop out of bed and get going for the day and get to work, but just so that they can exist. And it is a miserable existence. And so I think that's one of the biggest misconceptions. I also think that believing that people choose this for themselves, no one would choose to live addicted to a substance. It's a terrible, terrible way to live. And it's a disorder. People need help for it from the medical community. Another thing is that we did a survey. I think in 2019, we had done the survey where we asked over 1,000 people. Mayo randomly called individuals and asked them about, are they aware that opioids are addictive substances and that people can become addicted to them? Oh yes, everyone was aware. Everyone had heard that in the news. 73% of them said that could never happen to me. And you know what? They're wrong, because it can happen to anyone.
Mm-hmm.
Addictions do not respect socioeconomic level. They don't respect your sex. They don't respect your educational level. They don't respect, who your family is, how good it is, how bad it is, what your religious preferences are. None of that. everyone can become addicted. And until we know genetically who is most prone to addiction, we have to use universal precautions, right? We call that in medicine, where we treat everybody kind of the same. So that, because we don't really know how to single individuals out who may be at higher risk.
And two, you talked about how the addiction can happen to anybody. I mean, the people that are becoming addicted, a lot of it is it starts with medication, right? They were prescribed something. So it's not even like they're going out looking for a drug to get started to become addicted.
Mm-hmm. We know that over 80% of people who eventually use heroin, nobody walks out in the street and hunts for heroin to use, for goodness sake. You start by getting a pill out of your medicine cabinet or out of someone else's medicine cabinet. Over 80% of people who eventually use heroin started with a prescription drug. People, when they're young, are the most susceptible. So adolescents are particularly at risk. People in their early 20s, when they use opioids for the first time, their risk of staying on them and being addicted to them is higher. We also know that the higher the dose you use and the longer you use it, the more risk of addiction. And so when we give patients prescriptions after surgery, then we try to reduce what they use. We tell them to use what you need to manage your pain, but don't use it for longer than that. And don't use higher doses than you really need as a means of trying to manage that risk. But yes, what we prescribe is risky. I think you asked about misconceptions. Another misconception is that opioids are bad. I have cancer patients that I can barely convince them that it's time to use an opioid to manage their pain. But opioids are good drugs. They are really, they're probably one of the most important types of medication that has ever been developed and used. Thousands of years of opioid use, because they manage pain better than any other medication that we know of right now. And so they're good for patients who have surgery, for patients who have a major trauma, for patients who have cancer-related pain, patients at the end of life. But we just have to be wise about how we use them.
Absolutely. So my last question for you, doctor, is if people are looking for help, is there a phone number? Is there a website? How can the Mayo Clinic provide help?
Yeah, so we do have a website for Mayo Clinic, mayoclinic.org. We don't offer services, nationwide to individuals. So the best website that they could go to is the SAMHSA, SAMSHA website, where they will find all kinds of information and a big 800 number on there about how to get help. And they do have access to resources around the country. I do not work for them or endorse them, but that is a wonderful organization that the government supports to help us find help for individuals who need it.
And if people want more information just about, this topic or just a whole slew of other health topics, I mean, I mentioned at the top of the show, you are part of a podcast through the Mayo Clinic. So tell me a little bit about that and kind of the sort of things that are available to people there.
Well, that has been a really fun thing for me. I am doing a podcast called Mayo Clinic Q&A. We started it in 2020 in response to the COVID pandemic, quite frankly, because we wanted to be able to supply information in the moment to people, to consumers about COVID and about other topics that are of interest or that are of need for people regarding healthcare. A lot of our topics have been COVID-19 related. And because it's quick to produce, obviously you know all about podcasts, but we can get them to the consumer quickly. And people write in and ask us our questions and we try to answer them on the air. So it's been a lot of fun to do it. And I have learned an awful lot just about medicine and about podcasts too.
It's like that free information to people. It's invaluable. It's so important. We're going to have a link to that podcast in our show notes here. And Doctor, I can't thank you enough for being here with us and having this really important conversation here on Soul Source. This is something that, like you said, it's a growing crisis, right? So there's a ton of people out there who will benefit from this information.
Thanks so much, Raquel, for having me here. It's been a joy to be here speaking with you today. And I agree, it's an important topic for all of us to have some understanding of.
I want to thank you all for listening here on Soul Source and subscribe to our show. We're available wherever you listen to podcasts. If there's something you want us to talk about on the show, we can do that too. We have a Facebook group. It's called the Soul Source Society, and it's a direct link where you can interact with us. We interact with you guys as listeners, share special content only seen in that group, talk about shows, get ideas for future podcasts, and overall, honestly, we just have a lot of fun. That is the Soul Source Society on Facebook. We hope to see you there. Soul Source is brought to you by Red Shoes Inc., a leading agency specializing in crisis and strategic communications, media relations, social media, and so much more. To learn more about Red Shoes and Soul Source, visit us at redshoesinc.com.